All right, migraine headaches. This begins in chapter 13, mechanisms of action. So this involves nerve pathways and chemicals. And so we have changes that actually affect blood flow in the brain and the surrounding tissues. So an example would basically be vasodilation in those cranial blood vessels. So precipitating factors, these things that can actually bring migraines on, okay? Stress and emotion is a big one. Hormones and estrogen, or hormones, specifically estrogen, sorry. Alcohol, cocaine, caffeine, chocolate, which is what everyone is probably using these days, especially in nursing school, and MSG, right? MSG is monosodium glutamate. It is used in the food industry as a flavor enhancer. And commonly you'll see it in Chinese food, soups, processed meat. So glutamic acid is a neurotransmitter in the brain, and it's an excitatory neurotransmitter. Okay, and it's also responsible for, so when we utilize MSG, can also trigger migraine headaches. Effects of migraine medication. So effects of migraine medication. So stimulate serotonin receptors in the brain and basically aids in vasoconstriction. So serotonin, we know, is a chemical. It acts as a neurotransmitter, okay? And it has a wide variety of functions in the human body. So it's sometimes called or referred to as the happy chemical because it contributes to well-being and happiness, and it is mainly found in the brain, bowels, and even blood platelets. But a decreased level of serotonin is linked to migraines and depression. So when we talk about medications for depression, you're going to see this again, okay? So cerebral vasoconstriction. So that's one of the effects of migraine medication. So when we aid in vasoconstriction, it actually helps reduce migraine headaches. Associated symptoms, photophobia. So photophobia is sensitivity to light. Phonophobia is sensitivity to sound. Nausea, vomiting. The patient might even report seeing an aura. An aura is a change in vision. And it's a change in vision and their senses just prior to the onset of the migraine, okay? So something changes, they might even start seeing a halo around things where they know a migraine's coming, it's about to hit. Duration could be from anywhere from a few hours to several days. I've seen them last even longer than a week, so it could last a long time. So treatment is really prophylaxis. 2 or more headaches per month, the patient interprets disruption of activities, right? So think you couldn't probably really function very well if you were consistently having migraine headaches or one that lasted a long time or several within a short amount of time. Acute treatment is generally ineffective, right? So if we give something like, I don't know, an opioid analgesic to help reduce the pain, typically it really doesn't do much for the patient because they'll end up, as that medication wears off, with a rebound effect of that headache. Beta blockers. These block beta receptors in blood vessels, calcium channel blockers, and then tricyclic antidepressants in NSAIDs. Typically, we can use those to help reduce migraine headache. So with each occurrence, we might give prophylactic treatment, or there might be medication that the patient actually takes every time a migraine comes on. And then combination of agents and symptomatic treatment. So combination of agents might be multiple drugs or a medication that has a combination of more than one drug in it. And when we say symptomatic treatment, what we're doing is we're treating the symptoms that actually occur from having the migraine headache. Typically, nausea and vomiting is a big one. So we can give antiemetics, which aid in reducing nausea and then hopefully vomiting for the patient. Non-pharmacologic treatment. So non-pharmacologic treatment, we can do hopefully, educate our patient about lifestyle modification because stress can bring on headaches, right? And bring on migraines. So maybe a lifestyle modification, even diet, right? And so they should just avoid triggers. If they're figuring out what brings the migraine on, they should be doing everything they can to avoid that particular trigger. Pharmacologic treatment. So for pharmacologic treatment, we can utilize serotonin receptor agonists. Those are triptans, right? The suffix will be triptan. So if you see here, the prototype starred for that is sumatriptan, sorry, and we can give that PO, sub-Q, and even nasally, and it causes vasoconstriction and large intracranial arteries. Ergot alkaloid. So this is a combination drug. It's not a starred prototype for you to memorize, but just so you are aware of it. It is ergotamine and caffeine, and so caffeine has vasoconstrictor properties. Even though they say caffeine can bring it on, they're partially utilizing it in some of the treatment methods. And then alpha agonists. Alpha agonists, such as midodrine is how you can say that. That is a vasopressor and causes vasoconstriction. That's a starred prototype that you'll need to remember. And then you see here combination. Furoset is one that you see kind of pretty commonly used. Furoset is also a combination drug. It is not actually a starred prototype you need to memorize, but it is a combination of acetaminophen, caffeine, and butalbital, which is a barbiturate sedative. Nursing actions. We are going to assess for signs and symptoms, look at the patient history, assess for therapeutic and side effects. We also want to evaluate for serotonin syndrome. So with serotonin syndrome, remember, they can actually develop fever, muscle rigidity, seizures, agitation. Their reflexes will be hypersensitive or increased. Tremor, sweating, dilated pupils, diarrhea. It's a huge cluster of things that actually can occur. So we want to be careful of that, because if we're giving medications that can stimulate serotonin receptors in the brain, we could actually accidentally overshoot and put them into serotonin syndrome. And then patient follow-up. So they need to know to follow up with their primary care doctor or neurologist or whoever it is they're seeing for their migraine headaches. When should they follow up? What signs and symptoms should they be looking for? Those types of things.